As a parent, hearing your child cough may make you feel uneasy. Yet, an occasional cough doesn't always mean there is a problem. Cough is a reflex that helps clear the airways of secretions, protect the airway from foreign body aspiration, and can be the manifesting symptom of a disease. It is one of the most common complaints for which parents bring their children to a healthcare practitioner. They can cough several times a day or have coughing episodes lasting up to a couple of weeks if they have viral infections. However, coughing that lasts more than 2 to 3 weeks should prompt a visit to your physician. The most common cause of acute cough is viral upper respiratory infection. Today on your favorite health talk show, the physicians will be talking about all about cough in children. Do stay tuned. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course with my lovely co-host.
My name is Dr. Martina Agbere. Welcome to her favorite health TV talk show, The Physicians, where your health will always be
our business. Today we are talking about all about cough in children. Hey. All about cough in children. Okay, you are a child, you are somebody's child.
I'm always a child.
But again, this is a big issue for we that are parents. I will tell people it's not even about parents. Auntie, uncle, teachers in school, it's a big issue in this weather. Raining season, and you just have this, one child start with cough, the second one, before you know what, then the third, if you have like 3, 4 children, to go around, then it start all over again. You will not be wondering, who did you offend?
Yes, I just wondering how come everybody is picking it up.
Picking,
and when one starts, oh, this one you are starting again. I hope you won't give to the other person.
Then you even go to school and say, who is coughing in this class? My child is always coughing.
But the truth is that you, as parents, it becomes really worrisome. When you know that the child's cough is persistent.
It's persistent. Even worse at night.
At night.
Yeah.
And for parents that actually have children that are asthmatic,
that's another different ball game.
When the weather begins to change, the pollens are coming out.
Yeah.
You begin to get a bit
agitated. Yeah.
Mm-hmm. And you ask your child, are you putting on this? Ensure you do this. Ensure you do that. Yeah. Because the moment the cough starts, you know that something's about.
My major issue when it comes to cough in children is that a lot of parents assume so many things, especially if it's not you've had experience with older children. So you just think that this is just applies to this child, and then they just assume that they know the remedies to use, and it's not a one size fits all.
What me is them saying my child is ill, my child is not feeling well, and she has a cough. I just place her on antibiotics.
That is the worst thing. We don't even want to go into that. And most times, they don't even complete the dosage. So 2-3 days, the child is feeling better. The mother may even forget. And then antibiotic resistance is a reality. Imagine if you start messing up with a child's immune system as young as 5-6 years old. Yeah. Then when the child actually then needs serious antibiotics, they are already resistant. Well, we have an expert in the house, and this is how will I even, which adjective will I use for her now?
She's very passionate about children.
Very children, and being a pediatrician, and narrowed down to pediatric cardiologist.
When I invited her for the program, she said, no, Dr. Martina, this season, there's something in my clinic I'm seeing on the increase.
And this is exactly what we are talking about now. No. And cough is a major thing. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today we'll be talking about all about cough in children. And of course, with us in the studio is the amazing, lovely pediatric cardiologist, no other person than Dr. Chinyere Uzodimma, the MD CEO of Excerpt Children's Hospital. Dr. Chinyere, you're welcome.
Thank you so much.
You look
Dr.
lovely. I don't know
Uzodimma.
if you're aging backward now.
I'm pleased to be here.
As a pediatric cardiologist, you have to look at a consultant pediatrician. You have to look at our children.
You know, the more you stay with them, the more you become more
And
like
your
them.
smile is almost like, because you look at always smile at them, you know, so your smile is
No,
always
many people have to give us sweets. Because we are children now, she's supposed to give us sweets. So Dr.
I'm pleased to
Chinyere,
be
welcome.
here. Thank you.
So we're talking about all about cough in children. And we do not want to go into unnecessary things. We want the one that you give parents both so that they will understand where we are coming from. So I want us to go straight to this cough and what are the causes.
Thank you very much, Dr. Memuna. As we all know, cough is a very common symptom in children. In fact, it's noted that every child that is in preschool would have about at least 3 to 8 coughs per year, episodes of cough. And when I talk about preschool, I mean children under the age of 5. It is mostly more problematic amongst them. Cough, like you said in the intro, is a reflex. It's a reflex because the body uses it to defend the respiratory system. So when you're eating and you want to choke, you cough. It's a reflex so that you don't get too choked and then you're able to cough it out. You know, when the wrong things get into the airway, it stimulates cough reflex. But however, cough is also a symptom because there are other things that can stimulate the airway to become irritable. Things like infection and other things that I will just begin to talk about now, which are the causes of cough. Now, when you come to the pediatric age, like I said, pediatric age is 0 to 18 years, and everybody has their own brackets, you know. But mostly, I'll be discussing mostly about younger children more than adolescents. When I'll talk about adolescents, I will let you know. So the commonest cause of cough in young children is actually viral upper respiratory infections. Now, I need to break this down so that parents can understand. When we talk about viral upper respiratory infections, the respiratory tract begins from the nostrils we can see, down to the throat, the airways that is in there, and then before you get into the lungs. Now, anything that affects the respiratory system but spares the lungs is an upper respiratory tract infection. So what we are saying is that these viruses commonly would affect the airway from the nose, and that's why sometimes or most times you find out that cough comes with a cold. So the person is sneezing, is running nose or blocked nose, catarrh and cough and all that. That's the commonest way that cough presents with catarrh, and most often times is due to upper respiratory infections, which are caused most frequently by viruses. Now, second cause of cough that is important for us to address today is the one I would like to classify as coughs that are due to allergy, and then that is where coughs due to asthma, childhood asthma, also fall into. And I just want to remind us that asthma is actually an extreme form of allergy, you know. So now, coughs due to allergy means that there is a trigger. There is something that triggered it. There is something that when the child is exposed to, the cough begins to come up. This cough, this particular group of coughs, tend to be worse at night, because at night the airways are more irritable and they actually tend to be smaller at night. So things that irritate the airways would get worse at night. And also because at night temperature drops more than during the day. So what am I saying? Actually, some of these ones, this particular group, will tend to get worse, especially in the cold seasons. For instance, in the rainy seasons, like we are now, persistent rain, there is cold, the wind and all that is not very good for those who have allergy, because they tend to come up with that cough on and off. Now, the third group of cough that is important to address are coughs due to bacterial pneumonias. Very important one, you know. When a child is having a cough due to a pneumonia, remember when I talked about the first group, I talked about upper respiratory tract, sparing the lungs. Once this infection affects the lungs, it becomes a pneumonia. And pneumonia is usually a severe illness. Usually a severe illness, or considered to be a severe illness, because you don't want it to get out of hand. Then another group of cough that I would like to address is the one that is called whooping cough. People tend to misinterpret, misjudge, and everything about whooping cough. When they see a child coughing so much, they say, I think this child has whooping cough. But no, not really. Whooping cough is whooping cough. It is caused by a particular bacterial organism. And why it is called whooping cough is because of its characteristic. How it sounds and how it presents. And how is it? I'm going to try to mimic it.
Yes, I was going to ask you to do that.
Yes. So if you see a child with whooping cough, the child tends to cough persistently, repeatedly, in bouts, and then at the end of a bout, you hear a whoop. So I'm going to try to mimic that now. So you hear something like
repeatedly
in bouts, and then there's a whoop in between. So you hear something like so you hear that.
Whoop.
That's the whoop.
It ends with the whoop.
Yes. So
And
that's
it starts again.
exactly, and then it
Very
starts.
exhausting.
It's
Very
very exhausting, and unfortunately, it happens a lot in younger children, more in younger children
than
than older children. That is why actually the vaccination for pertussis is actually introduced from 6 weeks of age, because pertussis is not an illness you want a child to have really. Okay, now the other group of cough is the persistent cough. When cough lasts more than 2 weeks, is actually classified as being persistent. And in fact, the very important cause in that category is where we have tuberculosis. And it's actually recommended now that when somebody coughs more than 2 weeks, you should actually screen for tuberculosis, because we know that our environment is considered to be a TB endemic environment. A lot of people have TB that are moving about, and children get it from adult contacts. So these are some of the coughs. I would like to try to also point out some salient features of these groups or categories of coughs. Now, the viral upper respiratory tract infections, which are the commonest, oftentimes it may not be associated with fever. So the child is not hot. The child is not really sick, but you hear the coughing. But sometimes, even if there will be a fever, it will be a low-grade fever, like the body is just a little bit warm. But once you start having a high-grade fever, 38 and above, 39, is most likely to be a bacterial cause and will require more professional attention. Then secondly, about the cough is when you have a cough that comes with a wheeze. Again, I would like to demonstrate what a wheeze is.
Very important, please.
Very important. A wheeze comes with the cough in asthmatics. Wheeze, we like to describe wheeze as a whistling sound that comes with breathing out. Now, I like to demonstrate that breathing has two phases. There's a breathing, there's a breathe out. Most times we breathe, but we are not really conscious or aware that we're breathing, because we're breathing normally. But when you have a problem with breathing, you become aware of your breathing, because you now have to make an effort to do that. You have two phases of the breathing. So you actually have to watch out which phase that you're dealing with. So we have the breathing in and the breathing out. The wheeze comes with the breathing out. Now, the wheeze is like a whistling sound. I'm going to demonstrate it now. Or at least try to.
Try, please.
So here we go. So, there's a breathing, but with the breathing out, something that sounds like a whistling comes with it. There is something that may mimic it. It's called a stridor. Stridor comes with the breathing in. So it's like, yes, yes. So with the breathing in stridor, the noise comes. But with the wheezing, the noise comes with the breathing out. When there is a stridor, is a different cause. When there is a wheeze, is a different cause.
So one of them was the wheeze again.
Okay, here we go. With the breathing out. So there's a dragging of the breathing out. Usually the breathing out is a short one. The breathing out becomes dragged, and then you now have that sound like a whistling coming with it. When you hear that, it means that there is a difficulty in breathing. The airways have gotten tighter. Yes, tighter, and your child is actually struggling to breathe. So asthma can manifest in any age, but oftentimes maybe above 2. But these days, you see children, particularly if there's a strong family history, you will see children less than 6 months, they have classical wheezing associated with their cough. Is one of the signs that parents should actually watch out for when a child is coughing. And then, having talked about some of this, I would like to just, mention some of the things that parents that are watching, what should get you worried when a child is coughing. And I've tried to, make at least about 7 of them. So we just have to put it on our fingertips because I think it's something that we should actually go away with. If the child is coughing and has a high-grade fever that is 38 and above, it is very likely to be a bacterial infection. So you need to visit your doctor so that your doctor can decide what kind of treatment that you need to give to the child. If your child is less than 3 months and coughing, please don't even wait for 2 days or 3 days. Why? Because when infants of this young age cough, it may be a sign of a serious underlying condition, and they may not be able to cope with it for long. 3, if a child is coughing and has what we call postusive vomiting, so the child coughs, and then throws off the whole food that the child has eaten, is one of the reasons that you should get worried. Thirdly, the child is coughing and there are breathing problems associated with it. Whether it is a stridor, the one I say that happens in breathing in, or a wheeze, the one that happens with breathing out, or even a whoop, the one that comes in whooping cough, those are all breathing problems. When you notice any of those things, you should take the child to see the doctor. When the cough is persistent, in fact, ideally, you don't have to wait for 2 weeks at home. When a child is coughing, because most of the viral infection, those common causes, will resolve within 5 to 7 days. If the cough is lasting more than 7 days, please visit your doctor. And when I say more than 7 days, I mean a child coughs occasionally, does not have a fever, is feeding well, is running around. That's what I mean. That should make you wait for 7 days. But like I said, if there's a high-grade fever, breathing problem, you don't have to continue to wait. Number 5, if this cough deprives the child of sleep, so the child goes to bed at night and all you just hear is what, and the child is not sleeping, no, it is not good. You need to go and see the doctor. Thirdly, the child has feeding problems. Is not feeding well. Yes, because feeding is a very critical parameter in children, so particularly losing weight, very young children. Not just losing weight. Before they lose weight, they get dehydrated, they get weak. Yes, so you need to watch out for feeding problems. Then, I think I've counted the 7.
You have. So I want to know, because you have listed a whole lot. I was just so glued to listen to all that you've been saying. Before, 2 things I want you to deal with, the do's and the don'ts, okay, for mothers, number 1. Then secondly, that's myth. Just give vitamin C, or just give only water, or give just your paracetamol. You need to debunk some of these things, and the one that is should be held, they can go with.
Okay, thank you. So first, let me go with the don'ts. I want to do with the don'ts because the don'ts, if you do them, can lead to complications. So let's start with the don'ts. So one of the common things that parents do is they just walk into a chemist and go and pick up an antibiotic. Antibiotic is not a cough syrup. It has been so abused that some parents will tell you I gave cough medicine what is the cough medicine? They will mention an antibiotic. No. And I hope that our pharmacies should begin to watch out and try to curtail this.
Yes,
because it's
Selling,
possible.
yes.
Yes.
Selling.
It's not
Yeah,
about
so it's
selling.
not
You're
about
killing
selling.
lives.
Ethics,
Yeah,
the
the
ethics,
Yes,
it doesn't
so
allow
they
you
should
to
watch
do
out
that.
for that. The second one is when you notice that the weather is cold, like the season that we are now. The rains, make sure that your children are going to school
With
properly dressed,
Covered, yeah.
with cardigan. Don't let them just go exposed, because if they were not coughing in the morning, they'll come back to you coughing. Thirdly, cold drinks. Minimize cold drinks as much as possible. And if you can, encourage them to take something warm. That's not the time to start buying ice cream and start spoiling your child. Exactly. Then, air conditioner is good, but you must make sure that the temperature is adequate, at least from 28 degrees and above. Make sure that the fan is not placed to be steady. Let the fan rotate. And make sure the blades don't have a lot of dust on them. And make sure it is not directly and too close to the child. Thirdly, okay, I think those are the last one that I don't want to forget is what we call mentholated creams. Mentholated preparations, vaporized or non-vaporized. Some of them they put inside vaporizers or water and make it steam. There is no evidence that this helps, but there is evidence that it can actually get it worse.
Are you serious?
Yes.
That
So,
is steam inhalation?
not steam. Vaporized mentholated preparations. Yes. Mentholated preparations. So some parents will go and buy, I don't want to mention trade names, but mentholated preparations, those ones that will cause like a peppery sensation and all that, they will go and put it on the chest
And the child will be
and cover the. So if that child has allergy, a lot of children have ended up in the emergency room just because of this approach. If the child has a cough due to allergy, this will worsen it. The child will begin to wheeze. The airway will you just experience an acute worsening with that kind of practice. So they shouldn't do it at all. Now, what are the do's? The do's: encourage the child to have warm drinks. And like I have said, also dress the child warm. Liberal fluids, give more fluids. The child may not be able to eat those solids that they normally eat, but encourage the child to take a lot of fluids because they actually need it to stay hydrated. Then thirdly, saline nasal drops can help if you have cough associated with cold. Saline nasal drops means it's like salt water, but they have commercial preparations. You drop it into the nose. It helps to reduce the symptoms, makes the child feel better, and then the child can sleep better. Steam inhalation is good, but you must do it with caution.
Okay.
Now, I want to describe the procedure for steam inhalation. Steam inhalation doesn't mean that you get a bowl of hot water and put the child on top of it, because the child can actually suffer burns from the vapor.
So we hold the children like this and put the head.
So you just get the water that is hot, put it in front of you. Carry the child on your laps. On your laps. The steam is there. It's in the environment. You don't have to bend the child over.
I use blanket to cover the
Then
head.
you get a blanket. If you don't have a blanket, you can get a big bed sheet. Let someone cover both of you.
Really, there's a parent.
So you are with the child there. You are feeling what the child is feeling, and you know when to say, okay,
So let me take it off.
let it off. After a few minutes, you let it off. Then you cover again. That helps a lot. Then thirdly, among
Do you have
the
to
do's,
put something in the water?
nothing inside the water,
Okay,
just
just
the
the steam,
just the steam, the hot water.
Yeah.
Nothing,
Putting menthol in.
no menthol, please, no menthol, just the hot water. is
Dr.
enough.
Chinyere, it's obvious that we need a part 2 of this.
Quickly, Dr. Memuna, before I
Okay,
let
okay,
you go, I want to talk about cough syrup or no cough syrup.
Okay.
Because I've noticed parents will go to the chemist, cough syrups, and then they start looking for the one that works. There's nothing like the one that works and the one that doesn't work. It's about what is causing the cough.
The
So
pathology.
see your
The
doctor,
pathology.
see your doctor.
So-
Children should see their
Because if you
doctor.
identify the
Because
constitutive
Yes.
organism, you
So
can
it's
treat.
not about-
Yes,
yes.
if you treat
So-
underlying pathology, you are good
Yes.
to go.
So most times you
Yeah.
don't have to just go and pick up a cough syrup
Yeah.
and then you go back and say, give me the one that is working.
Dr.
No,
Chinyere,
it's not
in
like
fact,
that.
we see it
Thank
is
you.
obvious that we are this topic we are going to bring Dr. Chinyere back because we can't talk about cough more than this as it is right now. So please, parents, you're already hearing what she's talking about. There is no, let me put hot water, put menthol, and just go to the chemist, buy antibiotics, buy cough syrup. No, please. Go see your doctor with all the dish she has put. If it's persistent, if it's giving difficulty in breathing, if the child is less than 3 months old, all those things. That's what she's talking about. No vaporized, ventilated water and all that. See your doctor. Don't just give antibiotics. Till next time, remain blessed. My name remains Dr. Memuna Yusuf Kadiri.
Every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.